It's a terrifying time to be a parent and have teenage kids or even younger kids, and knowing that they are being faced with this dilemma, this problem, this issue where they have access to opiates and opioids, heroin, prescription opiates, knowing how dangerous it is, how lethal it is, and you've got somebody who is physically healthy and then in a short time they're dead because they took too much of this drug that they couldn't tolerate or didn't understand, or even if they had been taking it, you can be addicted for a while and overdose. And the bodies are piling up. It's really, really scary. It's very terrifying. And people are desperate. You know, they'll do anything. Having a family member with this problem is really, really hard. So pretty much you need to do whatever you can to intervene when you have a young person who's even beginning to experiment with these drugs, or where you're aware of their use, because it's highly lethal. We've had prescription drug problems for a long time, but in the last decade, the lethality has been unprecedented, and so we've seen more attention to that. If you have a young person, a teenager, a child who's using opiates, I don't think you can do too much in that situation, because literally the consequences are their death. So you want medical help as soon as possible. You want an addiction-related professional involved as soon as possible. You can't really overreact from a standpoint of asking for help or getting professional help. People are like, well, I don't want to overreact and I don't want to make assumptions or do the wrong thing. I mean, having someone go and talk to a professional, going as a family, I think is a really good thing to do. The family needs to be educated about if somebody has an opiate addiction or in their family. The parents need to be involved if it's a child or even an adult child. The parents, I like to involve at least a couple of other people in the family. If I'm prescribing medicine or if I'm prescribing treatment, I want the family to understand what the treatment involves. Now, I have to have the person's permission if they're an adult to do that, but I'll usually make that part of the treatment to increase the success, but also the safety. And now we have this situation where family members and concerned persons are actually giving their loved ones antidotes for overdose called Narcan. You got to be educated in that. And that's just more of an illustration of why you need to have family involvement and treatment that addresses the family system. You need to intervene when people are young because they have a brain. And the more the brain is exposed to a drug, the worse it is. The earlier you start and the more exposure someone has to a drug, the more severe their illness is going to be. We know that addiction starts in adolescence, and that pretty much if you can limit exposure to addicting drugs when someone is an adolescent until they become an adult, their chances of developing an addiction are statistically lower. And so addiction almost always starts in adolescence. So parents or family members who think it's okay to let their daughter or son have a drink or use substances or just experimenting with marijuana, we know that that increases their chances of having an addiction problem. So it is not a good idea. It's better to get an evaluation and get something done earlier rather than later. And that's why a lot of addiction programs do emphasize treating adolescents. And I know why we're going to have a program for adolescents precisely for that reason. And treatment is getting better. Treatment is informed now by research. More time, more resources, more people are studying the approach to the treatment of addiction and process addictions and trauma than ever before. And we're only getting better as a result of that. So there is a lot of really helpful information, and there are helpful tools that are available now that weren't available 10 years ago. There is a lot of help available that is effective. So never let anybody tell you that, oh, there's nothing that can be done. That's just not true.